Tourette is motor plus vocal, and chronic motor or vocal tic disorder is motor over vocal. If you have either of the motor or the vocal tic, we call it as chronic motor or vocal tic disorder. If you have both, we call it as Tourette. Reactive attachment disorder was of two types, emotionally withdrawn type and indiscriminately socially disinhibited type. These were two distinct disorders. Now, what they have said that reactive attachment disorder, emotionally withdrawn type is reactive attachment disorder in DSM-5, and is indiscriminately socially disinhibited type is disinhibited social engagement disorder. Do you understand the classification? पहले RAD के ही दो टाइप थे, एक विड्रॉन वाला, एक डिसइनहिबिटेड वाला. अब विड्रॉन वाले को RAD कह दिया और डिसइनहिबिटेड वाले को सेपरेट डिसऑर्डर बना दिया गया है. In delusional mood, the person says that environment appears to be changed in a threatening way. There is something abnormal in the environment. So the emotional component, or I feel there is something wrong going to happen. Now, see the first upper half of the screen. This is impulsivity circuit. The brain gets a stimulus, taking a substance. What is an impulse? Inability to stop yourself from initiating itself action. This is impulsivity. The stimulus comes from CSTC loop number 1, anterior cingulate cortex, ventral striatum, thalamus. Now this stimulus, this ventral striatum also get stimulus from DLPFC. You can see it is a top control over the ventral striatum, top control over the impulsivity circuit. Cognition. What is DLPFC? DLPFC is dorsolateral prefrontal cortex. The two main functions of dorsolateral prefrontal cortex are executive functions and working memory. What do you mean by executive function? Planning, organizing, sequencing, abstracting, cognitive functions.